So today we're going to talk about a very important topic, which is weight. Everybody is interested with the weight. Every time we're always taking care of our weight all the time, especially for modern women today, because we are very worried that we overweight, we don't look good, we cannot wear our favorite clothes. Okay, so why is weight gain important in pregnancy? Actually, weight gain is very important in pregnancy, and I'm sure every one of us know that, because every time we go and see doctor, the first thing they want to do is weigh you. Every time you go to the doctor when you're pregnant, we want to weigh you. So obviously weight is very important, right? And there's actually two aspects of weight gain that we need to think about. We want to talk about those underweight as well as those overweight. Actually, in pregnancy, there are some women who put on very extreme. There are certain women who put on reasonably. There are certain women who don't put on. And there are also women who lose weight during pregnancy. So there are actually a lot of different scenarios. So one is the ones that put on extremely. I've seen people putting on 30 kg in one pregnancy. Oh my God, 30 kg. And then, of course, we say what is normal? We say normal is 12 to 15 kg throughout the whole 9 months. But this is normal for women who are originally normal weight. Let's say I'm 90 kg, then I don't want to put on 12 to 15 kg. That's not normal. Although 12 to 15 kg is normal weight gain for pregnancy, but if you're already overweight, then your normal weight gain should not be 12 to 15 kg. So let's say if you are overweight, like you are already 70 or 80 kg during your before you're pregnant, then you should only put on like maybe 5 to 10 kg during your entire pregnancy. So, and there are also women who hardly put on, maybe they put on less than 5 kg or even lose weight during pregnancy. One thing we know, we want to talk about few scenarios. One thing I know about some women, many of us throughout the entire time before we are pregnant, we are always taking care of our diet, because we worry if we go overweight, we worry we cannot wear our clothes. So we are very cautious about what we eat throughout all our years before we are pregnant. And what happened is that once we're pregnant, then it's like, what freedom! It's like a freedom. This is the time you're allowed to get to put on weight and don't feel bad about it. So some of us actually during pregnancy eat a lot more, or eat a lot of things, tend to be less cautious. Like, we don't care this thing will be fattening or not fattening. We just eat and eat and eat, because we thought like, suddenly we get freedom to eat. Actually, I had that when I was pregnant in my first pregnancy, because all my life, you can see I'm a bit on the plump side one. So all my life, I'm always watching what I eat so that I don't become overweight. So when I'm pregnant now, I'm like so happy now I can eat anything. So I just whack everything. So that is why in my first pregnancy, I put on a lot. But of course, that has its own consequences as well. And I also have to pay for the consequences. Okay, so that is one thing. But I also seen some very interesting mothers, because they actually use pregnancy to lose weight. Can you imagine you use pregnancy to lose weight? Have you ever thought of that? And there are people who actually do that and successful. Why? Because if you want to lose weight, actually pregnancy time is the easiest to lose weight. Let's say if I were to not put on so much, because as I say, normal weight gain is 12 to 15 kg, which means that if I put on 12 to 15 kg, I will expect to lose about 12 to 15 kg after I give birth. Because that's the amount of weight you lose after your baby out, and provided confinement, you don't overeat lah. Some people confinement eat like, very scary, especially Chinese, because Chinese believe in overeating during confinement. So if you take care during your confinement, you also eat reasonably. Throughout the pregnancy, you also eat reasonably, and you didn't put on a lot of weight. Maybe you put on less than 10 kg. So let's say you put on like only 5 kg during pregnancy. So when you give birth, you're going to lose 12 kg ma. Let's say you didn't lose 12 kg, you lose 10 kg. So actually you lose 5 kg already lor. Can you imagine before you're pregnant, you are 55 kg. Then at the end of pregnancy, you're only 60. Then by the time you give birth, you become only 50, so you lost 5 kg. So I had this, I have quite a number of women who actually, I know one mother who tell me, I put on a lot already, very hard to lose weight, so I'm going to get pregnant now. So she get pregnant to lose weight, because every time she's pregnant, she can lose weight. And then when she's not pregnant, she cannot lose weight. So there are some interesting mothers where they actually get pregnant to lose weight. And then there is also, I also know one more lady, when she got married, she was like 70 over kg. She give birth one baby, she becomes 60 over kg. And then she give birth another baby, she becomes 50 over kg. Wow, so the husband married a plump lady, and then at the end she got a very thin wife. So these are the things that can happen in pregnancy. So actually, pregnancy can be a very good time to actually help some women to lose weight, especially if you're overweight, okay? So, but what is important now? Of course, more important is talk about health. So what is important? Is it okay to lose weight? Is it okay to put on? What is normal? So we always say normal is still normal. You need to be normal. So normal is 12 to 15 kg. If let's say you are overweight to start off with, let's say I'm already 70, 80 kg before I'm pregnant, then of course, in pregnancy, I still expect you to put on, but maybe don't put on so much. You only put on like 5 to 10 kg, and that is considered normal. If you're already overweight before you're pregnant, you don't want to put on 12 to 15 kg just like any other person, because then will be overweight. At the same time, we also do not want you to be too underweight. It has its own problem, especially those people who lose weight during pregnancy. There are people who actually keep losing weight. It's normal to lose weight during the first 2-3 months of pregnancy because you're vomiting, but it's fine. But after that, your weight must come back. But there are some people who keep losing weight. Of course, it has its own problem. But actually, we are more worried with overweight than underweight. Why are we more worried with overweight than underweight? So what are the problems with overweight? Problems with overweight is number one, we talk about diabetes. So diabetes got to do with what is your weight before you're pregnant. How much weight do you put on during pregnancy? All this got to do, makes your risk for diabetes higher. Diabetes is one, high blood pressure is another one. So if you have listened to my video on preeclampsia, you will know that hypertension and preeclampsia all has a lot of problem. It can be potentially life-threatening to both mother and baby. So of course, everybody wants a healthy pregnancy, a safe pregnancy. But then if you are overweight, then you are at risk of preeclampsia, or hypertension, which can be quite risky to both baby and mother. And also, we also worry about diabetes, which can be high risk to baby. Diabetes is mainly affect baby. Baby can die because of diabetes. Baby can also die because of mother hypertension. And mother can also die because of hypertension, but mother don't die because of diabetes. So we do not want hypertension and diabetes. That is the main two things why we do not want you to have too much weight gain. Then there's another problem with weight gain in pregnancy. That's what happened to the baby. It's not just diabetes. Okay, diabetes number one. So what are the problems when you have diabetes to the baby? Number one, we know that if you put on too much, you have high chance of diabetes. And then if you get diabetes, then baby has its own problems. Baby have more jaundice. Baby have more difficult birth, more injury during childbirth because baby is so big, difficult to come out. It's more likely to injure the baby. And also, we talk about weight gain that resulted diabetes in the mother causing the baby next time to be diabetic. So now we know that diabetes is due to it's not really inherited, but rather my mother pregnant got diabetes, so I will get diabetes when I grow old. So we do not want to pass the diabetes to our baby. So that is why it's best not to be overweight. And also this is what we call fetal programming. So mother if tend to be overweight, these children tend to also grow up as overweight. So all these things got to do with fetal programming. So then babies tend to be overweight, or childhood obesity, which will in the end up with hypertension as an adult, or even diabetes as an adult. And of course, when you have hypertension and diabetes as an adult, then you have all your risk of heart disease, kidney failure, stroke, and things like that in the future. So actually, in general, my mother put on weight too much. You don't just affect your baby in the pregnancy, but for the rest of his life or her life. So the rest of his life or her life, his health depends on your weight gain. So we do not want you to go overweight so that you have healthy babies who eventually also will become healthy adults. But if you overweight, then we only worry about the baby not so healthy, and also at the same time not so healthy adults as well when they grow up. So that is the part on hypertension and diabetes when it comes to overweight. But that is not all. That is not all. What else? When you become overweight, you also have to think about what's going to happen during childbirth. During childbirth, before childbirth. You must understand, when you're overweight, you tend to injure your body. You tend to have knee pain, pelvic pain. Actually, all this injury, it is not just during pregnancy. You may feel better after you give birth, but all these injuries can cause long-term problems when you grow old. So when you grow old, then you have this pain, that pain, that pain, that pain. Actually also got to do with your weight gain during pregnancy. Because when you're overweight, your poor legs have to carry you, your poor pelvis have to carry you. So there is high likely of injury. That's why you have all this pain during your pregnancy. You look at all those thin mothers, they don't actually feel a lot of all this pain, but the ones who are more overweight tend to feel it. Especially those who too much weight gain during one pregnancy. It's like such a short period, you put on so much, your body cannot take it. So you tend to injure certain parts of your body before your birth, and that can also cause you to have certain of all this pain here and there, your joints here and there when you grow old next time. And also birth itself can be difficult. We know that mothers who are overweight, it doesn't matter whether you are generally overweight or you put on too much only during this pregnancy, your chances of a cesarean section is higher because it's more difficult to give birth. And if you end up with natural birth, if because of your weight gain, the babies tend to be bigger, they also have higher tendency of causing birth injury to baby. Babies can get injured during childbirth, especially if they're too big, because it's difficult to come out. Even if for Caesar, if your baby is too big, it's also very difficult to come out. Many of you don't realize when you have Caesar, you thought you lie down there, you don't know what's happening. Do you know who is pushing the baby out? It's usually the nurses and the doctor. And if your baby is very big, then sometimes it's so very difficult for a baby come out even in Caesar. Then we end up maybe use forceps or things like that. And again, we can potentially injure the baby as well. But that is because the baby is too big. So if you do not want so much birth injury, whether to baby or to mother, then it's better not to be overweight. So these are the problems with being overweight during childbirth. Then there's an after childbirth problem. Because we know when you're overweight, the blood tends to be more easy to clot. So this can be potentially also life-threatening. You say mothers give birth, happy, give birth already. Then what happens after you give birth? One of your blood vessels block, and usually the one we worry most is the one in the lung or the one in your calf. So the one in the lung is the one that we worry most. The one in the calf also we worry because deep vein thrombosis. Because deep vein thrombosis, the blood clot can dislodge and go to the lung and block your lung, then you cannot breathe. Or the blood clot that is at the lung already blocked the lung, that was called pulmonary embolism. And this can happen within few hours after birth. And it can be life-threatening. It can happen within few hours after birth. It can also happen any time during your confinement. And then suddenly you cannot breathe, and most likely you will end up in ICU, and most likely it's life-threatening. You can actually die of it. In countries that are developed, we say developed countries, like UK, US, and places like this, they actually this pulmonary embolism is the number one cause of death in pregnant women. Number one cause of death in pregnant women. And we know they tend to be more overweight as well, these countries, compared to the underdeveloped countries. But in Malaysia, please watch out, because our obesity rate is very high. Actually, our overweight mothers is also very high compared to other underdeveloped countries. So actually, we also have quite a lot of pulmonary embolism. In our country, it's also either number one or number two. It's either one. Pulmonary embolism is still the top two reasons why mothers die from childbirth. So we need to take care of our weight, okay? Like recently, I have one patient, she's like 140 kg. I look at her, she's very happy being 140 kg because she said, my baby live in a bungalow. I was laughing out, but I laughed out when she said that, but in my heart I was crying, man. Because, yeah, your baby live in a bungalow, but actually I'm very worried for her from the beginning of pregnancy until now. I'm still worried. I will probably worry for her until after she give birth, because we know that she is very, very, very high risk. Very, very high risk of pulmonary embolism, which is the main thing I'm worried. Because she's third pregnancy already. Her first two pregnancy also very difficult to come out one. I would describe like both her pregnancy is like miraculously she delivered normally, you know. And now she's third pregnancy. Again, I very worried. Don't know whether she can deliver normally. Don't know whether she can... whether miracle is going to happen on her again for the third time. Because when you're so big and you're so much fat down there, the head cannot even engage. That was a problem every pregnancy. But still, I also worried for things like pulmonary embolism that she will get after birth. So far lucky she doesn't get diabetes or hypertension, but we still worry about pulmonary embolism, whereby the blood can clot and block the lung and then cannot breathe. So we are very worried. So weight gain is something that we need to take care. We need to take care. Okay, so don't be just like me, you know. Don't be like me. When my first pregnancy, I was so happy. Oh, suddenly can eat already. All my life I've been on diet, trying to control what food I eat, and then suddenly when I'm pregnant, I thought I have free will already. Now I can eat whatever I want. But as a result, I also regret, because I also developed diabetes. I was also overweight. I put on more than 20 kg during my pregnancy, and then I had a prolonged labor, secondary arrest. Baby cannot come out. Baby was too big. I ended up with seizure. So, you know, these are the consequences of me overeating. So I regret it. So that is why it is very important to actually take care of our weight during the pregnancy. Yeah. So the other thing is, sometimes some women when they put on a lot, you know, they come and see me and it's like 3 kg, 5 kg in 1 month. And then you say, wow, you eat so much. No lah, doctor. I very take care already. You know, normally what I'll tell them, you cannot bluff me one. If you put on 3 kg or 4 kg, you never take care. No matter how you say you take care, you're still not eating correctly. So then we will go through what you eat, breakfast, lunch, dinner, tea, supper, everything list down. Sure got one problem one. And what is the biggest problem that a lot of women don't realize? A lot of people don't realize. They always think that, no lah, I really very take care. I don't take fried food. I don't take, oily food. Then I'll tell them, pregnant women put on normally not due to oily food one. Okay, normally not due to oily food one. It's always due to, most of the time, due to sugar. It's due to sugar. So it can be pure sugar. What kind of sugar we're talking about? Number one, a lot of pregnant women love sweet things. So simple things like cake, ice cream, even your, Milo. So being Malaysian, we love Milo, right? We from young, we hear Milo, right? That song can drum into us so that we can be sehat. So, but it's not true. Milo is so unhealthy. So sugar is number one. So they like to drink Milo. Not to mention all your other sweet drinks that you have. Ribena. I have mothers who tell me, doctor, I have to drink Ribena every day. Can I drink Ribena every day? No, you cannot drink Ribena every day. But these things is quite simple for people to understand. If I tell you, don't eat sweet things, it's okay one. You can stop it one. You can don't eat cake, you don't eat chocolate, you don't eat sweets, you don't eat all your kueh, you don't eat all your dessert, and then you stop your Milo, you don't drink all your sweetened soya bean or whatever. You can, but there's one more thing that a lot of people forgot. They will think that it's healthy, but actually it's sweet. Okay, when people say healthy, maybe they say, morning what you eat? I eat oats, I eat Nestama. So then I will ask them, you eat 3 in 1 Oh yeah, lor, doctor. You see, because we like convenient, we buy 3 in 1. Do you know that 3 in 1 Nestum or Quaker or oats is actually very, very sweet? That is one thing. They thought they're eating healthy breakfast, but actually it's very sweet. Another thing is fruits. We always forgot fruits, because from young, our teacher, everyone teaches already, fruit is healthy. Fruits is healthy. But we forgot fruits is very sweet. So when you're pregnant, when you eat fruits, you put on weight. You can put on non-stop one. So fruits is actually very sweet. So this is one more thing you have to control. So you have to look at what fruits you want to eat. The fruits, you have to choose what is not sweet fruit. I don't know what is not sweet fruit. Is it sour fruit is not sweet? No, doesn't mean it's sour, it's not sweet. No, some sour fruit also got very high sugar content one. So how to know which fruit is sweet or not sweet? It's so easy lah. You open your phone, sugar content in fruits. Then you come out the whole list of fruits there. Now you look at the sugar content in fruits from up to down. You look from the lowest up lah. Lowest up. So when you choose your fruits to eat, you must choose the low sugar content fruit to keep yourself healthy during pregnancy. Then after these two, then what is next? What is next? Malaysia's staple food. What is Malaysia's staple food? Rice. You know, we cannot live without rice, bread, noodles, bee-hoon and things like that. But actually, they are also carbohydrate, and especially if it's simple carbohydrate. What we say simple carbohydrate, anything is white in color is simple. So white rice, bee-hoon, kway teow, white bread, all these are white. When it's white, again, the sugar content is quite high. Sugar content high, then you are supposed to eat. You can eat. I normally don't say pregnant women don't eat rice. Very rarely I will ask women to do that. Most of the time I let you eat. But take in moderation lah. Don't take so much lah. You know, doctor, I'm very hungry, so I eat 2 bowls of rice. Don't eat 2 bowls of rice during pregnancy, okay? You have to control your rice intake even. You know, some people, breakfast rice, lunch rice, dinner rice. Because Malaysian like to eat rice. Breakfast nasi lemak, lunch is rice, dinner is again rice. So when you take so much rice, actually you're also eating a lot of sugar. Unless you can really eat healthy rice lah, like brown rice lah, red rice lah. I always encourage mothers to buy red rice one, because the sugar content is a lot lower, and it actually keeps you full longer, slightly better than brown rice. So that's why I always encourage red rice, because it keeps you full longer. It's also important to keep you full longer, because once you keep full longer, then you won't keep going and find bread lah, biscuit lah. You know, pregnant women hungry, keep looking for food one, and then all your bread and biscuit is again sweet. So you see, so these are usually all the things that are causing mothers to put on. So when you are pregnant, you need to control. You can still eat rice, but eat in moderation. But just, you can eat fruits, but make sure you don't choose high sugar fruit. And then all the dessert, try not to take at all if possible. It also depends on you. If let's say you are already putting on a lot, of course you have to be very, very strict lah with what you eat. But if let's say your weight gain is still okay, then you keep it lah. But when you're overweight, then you have to cut lor. Also, these are the things that you need to take care when you take care of your during pregnancy. And then another thing is one thing I want to mention is I also see a lot of mothers who say, I want natural birth You know, when you want natural birth, then you must make sure that you take care of your diet lah. Because I already say, if you're overweight at the end of your 9 months, then your chances of Caesar is very high. So if you don't want Caesar, then you have to take care of what you eat. Sometimes I really stress there. They all every day say the mothers will tell me that they want natural birth, and then their weight gain keep going up, and then they don't care, and then they keep eating, and then you say, wow, you overweight, and then they just laugh, ha ha ha, and then in my heart I will cry. You put on weight, and then you put on so much weight, you don't take care of your diet, and yet you say you want natural birth. I think it's not easy lah. So if you want natural birth, then you need to take care of your diet. Yeah. Next is, we don't talk about those people who are, now we talk about the overweight, then we talk about the underweight. So underweight sometimes also can be not so good, especially when you are losing weight, because you're losing weight, main thing it affect what? Baby also tend to be smaller, and then cannot put on, tend to be, we call growth retarded, and growth retarded has its own problems as well. So that's why we also do not want you to keep losing weight. So what you should aim throughout pregnancy is, if you are normal weight to start off with, then you put on 12 to 15 kg. If you are overweight to start off with, then we only want you to put on 5 to 10 kg. If you are extremely overweight to start off with, then you should not put on more than 5 kg in your entire pregnancy. Okay? So this is the general rule of thumb. But if you're thin, then you don't lose weight some more lah. Okay. So sometimes that's why I say, women, if you think you're overweight and you want to lose weight, whenever you're pregnant, just don't put on so much. you naturally will lose weight already. Because if you put on like 5 to 10 kg, then you definitely will lose 12 to 15 kg after you give birth. So that means you lost weight already. After give birth, you'll be thinner than before you get pregnant. So that is perfect, right? So that's what a lot of women, especially if you're overweight, you can actually use pregnancy to lose weight one. Okay, so yeah, this is all about weight during pregnancy. You have any questions, please put it up. You have anything you want me to talk about, please also put it up in the comment section so that I will take note of it, and then I will put it in my list and I will bring it up one day, okay? And thanks for all your questions, keep coming in so that I have new ideas of what to talk about in my future live videos. For any of you who have missed any of my live video, please go to my YouTube channel, Dr. Tan City Clinic. You can go through and subscribe, yeah, don't forget to subscribe, yeah, and then you can see all my videos there, all since the beginning of MCO already, almost more than half a year already. Yes, Sujin, overweight can cause preeclampsia. Not everyone, but it is one of the problems. But if you want to know more about preeclampsia, then go to my preeclampsia video, because preeclampsia can be prevented already once. So if you don't want preeclampsia, please go to my video. And weight is also one of the criteria. When we do the preeclampsia testing to predict whether you have preeclampsia or not, we also need to put in your weight. You see, it is one of the factors that we have to consider. Shu Yong Tan say, may I ask if husband got diabetes but mother don't have diabetes, is baby will get diabetes? Normally we say there is still a small percentage that it will happen, because we do see something like that, but what we still think that most of the time diabetes is from mother lah, not from father, okay? But there are small proportion that still come from father. Yo-Yo say my GTT test is 8.3 but my weight never gain, keep remain as 47. Okay, of course you can also have diabetes without putting on weight. You see, weight, diabetes, this thing, there's two extremes one, you know. There is the overweight diabetic and the underweight diabetic. So you are most likely the underweight diabetic. So you can still be diabetic even though you're underweight. Because diabetic got two types, one, got overweight and underweight. Okay? You have diabetes, but being overweight, the chances of diabetes is higher. But as I say, you have an underweight and overweight diabetic. But we don't see as many underweight diabetic compared to overweight diabetic. Fatin asked how to share tips to avoid too much weight gain during pregnancy and how to reduce weight before pregnancy. Okay, during pregnancy, right, I told you already that is basically due to sugar. Why? Because we say pregnancy is a diabetic state. Pregnancy is a diabetic state. So sugar is the cause of your weight gain, and to control, you need to control your sugar. But before pregnancy, then it's different. Each and every one of us have a slightly different metabolism. Some people are also prone to diabetes. If you're prone to diabetes, like your family members all diabetic, you want to lose weight, it's very easy. You also need to be on some form of diabetic diet or keto diet in order to lose weight. But some women, they are not diabetic, or they're not prone to diabetes, so cutting down sugar is not going to help them lose weight. Then what they need is calorie reduction. So you can either go on calorie reduction or on diabetic diet or keto diet. So it very much depends on what is your metabolism. So not everybody have a fixed way of losing weight. But in general, we always say that the less you eat, the easier you're going to lose weight loss. So that is a general rule of thumb. Exercising, it's not that I don't believe in exercise helping you to lose weight. It definitely does help, because it boosts up in your immune system. It helps you to burn sugar better as well for those who are diabetic. But to really use exercise to lose weight without controlling your diet is going to be very difficult, because in order to really use up a lot of calorie, you really need to really exercise. Like I always say, like I got one son. My son, no matter how much he eat, he never put on. Why? Because he exercised 20 to 30 hours a week. If you can exercise 20 to 30 hours a week, of course whatever you eat also you cannot put on. It's still so thin. But you exercise 20 to 30 hours. How many of us can do 20 to 30 hours exercise a week? Eva asked how to use pregnancy to lose weight. Please teach me. So I already told you, don't put on so much during pregnancy and you sure lose weight already. Ho Kim Fong asked how to contain hunger pangs during, we strike every 2 hours. Oh, that one very easy. Actually, that one very easy. Okay, what I'm going to tell you is, yeah, it's very easy because what happens with hunger pangs? You know, some people, I know what you mean. You eat, after another 2-3 hours, suddenly you feel very hungry, and then sometimes even you feel like sweaty, and then sometimes even you shake or you feel dizzy. You're really, really hungry, you have to eat something. Actually, why does it happen? This thing happen is because of sugar, purely sugar. Because when you take something that is sweet, your sugar go up very fast. So when your sugar go up very fast, especially in diabetic state, so it's either you are prone to diabetes or you are pregnant, because pregnant is diabetic state now. So non-pregnant women also face this problem if they are prone to diabetes. Pregnant women always face this problem because pregnancy is a diabetic state. So if you eat sugar, anything that has sugar, let's say your Milo drink, or even your coffee in the morning with sugar, or even your small little nasi lemak, your small little bihun, you thought you eat so little bihun for breakfast is healthy, but because you eat something that is sweet, the sugar fly up very fast. Body reaction is press the sugar down, suppress the sugar down fast. So high, cannot, no good. Suppress it down fast. So when you go up fast, come down fast, then you suddenly very hungry. So how to settle this problem? Very easy. Don't take sugar. Because let's say if for breakfast I eat 2 eggs, then my sugar don't go up because it's not sweet. It just go up a bit only. You go up a bit, your body is not going to press the sugar down. So it can maintain for a long time and slowly come down. So you get what I mean? So you will realize it's actually what you eat that cause that. So if you eat something and then after 2 hours you're very hungry, then you cannot stand, you have to eat something one. Then you ask yourself, just now what I eat. Make sure you don't eat that thing again lah. As long as you don't eat that thing, you don't have this hunger strike, you know, it's like so hungry you cannot control. Actually, people who totally don't eat anything, let's say you totally starve yourself, you don't have this hunger strike one. You get this hunger strike only if you take sugar. So avoid sugar, avoid things that cause high sugar, and take things that are supposed to be low sugar or can keep your sugar level steady lah, like those red rice, brown rice. But brown rice sometimes I feel also quite fast hungry. So to me, I feel that it's still red rice is always better. Okay, so or else just keep to things that are not sweet, should be fine. So Ho Kim Fong, I hope I answered your question already. You're not supposed to have hunger during midnight if you never take sugar, okay? Without sugar, you won't be hungry. You only get hunger strike when you have sugar. So avoid sugar lah. Yes, suji and banana is very bad fruit to eat when you're pregnant because the sugar level is very high. Ho Kim Fong asks, so do we do low carb diet or ketogenic diet? It all depends on your level of your diabetes lah. So we don't normally say that. I mean, very rarely we say you should go on keto diet. In fact, generally we will say no. Only in very, very extreme cases. Most of the time we just say low carb lah. We just want you to be on low carb. Okay, or if you want to take carb, then take good carb. Don't take bad carb. Like as I say, eat red rice, don't eat white rice. Something like that, okay? Marina Chin asks, what about black rice? I think there's 2 types of black rice out there. There's a blackberry rice and a black rice. A true black rice and a blackberry rice. Of course, true black rice is good, but blackberry is actually sweet. So we don't take blackberry rice. You want to eat black rice, you have to eat true black rice. I prefer red rice because red rice tastes better than black rice. The true black rice, I think, is very hard to eat alone. Red rice on its own, you can eat red rice on its own. You don't need to mix with white rice. So somebody asked about milk, and yes, milk also can be very, depends on what milk you eat, what milk you drink. Honestly, all pregnancy milk, I feel that their sugar level is too high, so they don't drink pregnancy milk. Milk is important in pregnancy, but don't take pregnancy milk. Take normal milk. What's the best milk? Fresh milk lor. The milk that you buy from supermarket, you know, in the cold segment where it's called fresh milk. Don't drink low-fat milk. Low-fat milk is sweeter. You want to drink, you drink just fresh milk, okay? Eva asked, does the weight gain including the weight you lost in the first trimester or the weight you start off we start from the weight you start off. So if you go down, of course we allow you to go up lah. So we look at the weight you start before you're pregnant. Kong Shani asks, how about weight gain after quite a long time after delivery and loss of body shape? I think that one I explained earlier already. So if you're not pregnant, the way of losing weight depends on your body type, your body metabolism. So each and every one is different. It's always better to see a doctor that does more weight gain. There are some doctors who do a lot of weight loss program. These are the type of doctors that they actually know how to measure your metabolism and decide what to do with you. But in Malaysia, I think not many. Overseas actually got, especially US, because obesity is very high in US obesity. So in US, you actually have weight management doctors to do nothing but weight loss only. Choylin asks, is glucose test required to be done in all women or only those who are overweight? There are many criteria, not just overweight. We look at a lot of criteria, and based on all the criteria, I would say 70 to 80% of pregnant women in Malaysia would need to do it already. Either that or all of you be on diet lah. So depends on those days when I was in government, we tend to do almost everyone, you see, because almost all of you will have some of the criteria met one. But then now that I'm in private, I do less and less, but I tend to have more or less make most of my mothers go on diabetic diet lah, in a way, because number one, we all know that chances of diabetic pregnancy in Malaysia is very, very high. Malaysia is very, very prone to diabetes. So one way is just take care of your diet from the beginning of pregnancy. You'll be safe already. Because even if I give you a glucose test and I tested positive, in most women, all you need is to just take care of diet. So if everybody is taking care of your diet, that should be fine. Is the fluid in the womb increased because of diabetes? Yes, one of the reasons, in fact, the main reason for high high fluid level in the womb is due to high sugar. So the thing is, like government, they like to give KK, they like to give the glucose test, but sometimes if you test and then you see it's normal, then all of you just simply whack all kind of sugar one. I think it's worse because we know that test is not accurate. So even if it's normal, you can still be diabetic one. So you cannot whack all kind of sugar. Basically, you still need to take care of your sugar. Shazila, macam mana nak tahu overweight tapi boleh natural birthing? GDM on diet, 36 week, berat baby take 3 kg. Boleh ke saya bersalin normal? I mean, boleh, definitely boleh lah. But your baby is very, very big, you know. 36 week, 3 kg. You nak cuba, memang boleh cuba. Tapi boleh keluar ke tak? Lain cerita. So, tak patut macam itu. Tak patut baby 3 kg lah. Kalau boleh, lepas ini on diet ya, you masih ada 2 minggu untuk kalau boleh turun 3-4 kg lagi. Pregnant mother can go on diet and lose weight, especially if you already put on too much. If you put on too much, then pregnant can lose weight lah. A lot of time when I ask mothers to lose weight, say pregnancy can lose weight, man. You already put on so much. It's time to lose weight because we want to aim normal weight, 12 to 15. So if you put on too much, then please lose weight. Underweight diabetic can get more chance to have natural birth or not. I mean, you have slightly better chance because you are underweight. But if your baby is overweight, then it's also can be a problem. But of course, it's better than you also overweight, baby also overweight, then it's a bigger problem. So at least you are not overweight. But if your baby is overweight, then it still can be difficult lor. Okay, is it okay, Fatin asks, is it okay for pregnant women to run and work out? Yes, why not? Pregnant women are supposed to exercise, okay? You're supposed to exercise. The only thing is, have you always been exercising? It's not easy to, and you're carrying such a big baby and you start jogging. It doesn't work that way. So women who all along work out, all along jogging, I usually encourage them to continue workout and continue jogging throughout pregnancy because you're used to it, ma. You're used to it, then you can continue doing. Is it true it is dangerous for women to run or do high impact workout during first trimester? No, if you are already used to it. Don't push yourself too much. If you're doing high impact, you may need to reduce like 20 or 30%, but you can still continue doing. You just reduce a bit. But don't push yourself too much, but you can still do. Jogging also the same, you can still do. Maybe you cut down by 20-30%, but you can still do, yeah? May you ask that the husband is having discoid lupus and all kind of medication he's taking. Is it okay to get pregnant? Yes. As long as you can get pregnant, it's okay. Because your husband is husband. If all those things affect his sperm, then you may not get pregnant at all. If you can get pregnant, then that sperm that let you pregnant must be a good one lah. So don't worry, you can get pregnant. Cheris Bowie Chan, I used to exercise 4 days a week before pregnant. I'm 6 months pregnant now, still doesn't have energy to do any exercise. Yes, it's because you stop, Cherries. It's because you stop. So when you stop, then it's very hard to come back already. So that is why when people pregnant, they shouldn't stop. They can reduce 20 to 30%, but they should continue exercising. Because once you stop, it is very hard to come back. And during the first trimester, a lot of people feel they're very tired. That's why they have no mood to exercise. But actually, if you really start back your exercise, you no longer feel tired. And in fact, you feel very fresh throughout the whole pregnancy. So actually, when you exercise in the first pregnancy, your vomiting reduce, your nausea reduce, your tiredness reduce, you're very much fresher. So actually, you should exercise even in the first trimester, especially if you are the type that used to exercise. Used to exercise, then continue. Not used to exercise, then you don't start in your first trimester, okay? Charlene Gunn asks, does those plant-based protein shake will cause weight gain as well? Yes, if you have sugar. You know? Yeah, you already know it's sweet. Plant-based, there's so much sugar in plant. There's so much sugar in plants. So you must understand, if you have plant inside and it's sweet, then it's again no good. Yes, Sandra Leo asked about milk. Milk is good, but sugary milk is no good, yeah? So choose your sugar properly. Yes, Fatin has answered. Eva says she's a fitness instructor, so she gave all those advice, which is true. So if you're all along exercise, you can continue exercising during pregnancy, yeah? Even from the beginning of the pregnancy. Kong Shanice asked, when I was pregnant, I was prone to become sleepy. Is it normal for pregnant? Yes, it's quite normal to be sleepy, especially if you're not exercising type, lor. If you're exercising type, you're very fresh one. You won't sleep one. So, Leon asked whether wheat cereal Jacob biscuit will cause weight gain. I think there are two types of wheat cereal Jacob biscuit, the round one or the square one. I think the square one is fine because the square one is actually very plain one, but the round one is not so plain. So it also depends on what you eat. But anything if too much also will cause weight gain lah, because it's still carbo no matter how. Just like rice, we say red rice is good, but you don't eat too much. So you want to eat wheat biscuit, of course, better than any other biscuit in the world, but also not too much. When too much is also sugar. Is it okay for pregnant women not gaining any weight or lose weight during pregnancy? Will it be not enough nutrients? That's why I mentioned, if possible, we don't want. If you're very, very overweight, we still expect you to put on, but less than 5 kg, but still put on. It very much depends on your weight before your pregnancy. Doc, I'm 72 kg. I'm scared to get pregnant with this unhealthy weight. Actually, it's not a problem. You can get pregnant, but make sure you control your weight during pregnancy, lor. You're 72 kg. If you don't put on too much, maybe you just put on between 5 to 8 kg during your pregnancy, then you help to lose weight. Then after give birth, you'll only be 60 something only. Eunice Fu says she's proud to be my patient because you always put effort to share so much knowledge. Thank you, Eunice Fu. I'm also happy to have you as my patient. Okay, can underweight diabetic mother have natural birth? Of course you can. Okay, so that's all the questions you have today. Yes, okay. Thank you once again. Actually, today there's so many conversations. Actually, happy that you all are putting a lot of conversation inside. Is plain yogurt okay to take? I mean, if it's plain, it's good lah. It's no problem as long as it's not sweet. Okay, so that's all for now, and I will post up the next topic soon in a couple of days. So see you again next week, same day, same time. Thank you. Bye bye.